guys, so I'm Dr. NAMRATA JADWANI TAKHTANI. Firstly, a very good morning to all of you, and I just thought that it's a great opportunity to do this with dental leaders of India. I'm just going to take you through my day, a very realistic picture of what my day actually looks like. So very shortly, I'm actually going to give you a glimpse of what my day at the clinic looks like. Like I said, a very realistic glimpse of what the actual behind the scenes is. So join me, and I hope you stay tuned for the entire day today. Good morning. So we're all getting set for today. That's my team. That's the clinic. We're having our sterilization done here. Sterilization, cleaning, everything's being done. Okay, so here we are. I just gave you a glimpse of my clinic and how we usually kickstart the day. So we usually come in about an hour earlier because we like to keep everything extremely clean, and we spend a lot of time in our sanitization. We also do patient confirmations in the morning. So we know if anyone's cancelled. A lot of patients just don't end up informing. We have a sterilization procedure, cleaning procedure. So when the first patient is there, we're completely ready and geared up. After this, I usually sit with my cup of coffee being very important, and go over the work that we have for the day, what's coming from the lab, and what we're supposed to see for the day. What are we looking at today? We're looking at PFM trial. We have a temp cap going in, a cast post trial. This is one of the bigger cases we have to see, which is implants and PFMs together, as you can see. And this is a veneer mock-up, new case in the making. So yes, the pandemic has slowed down quite a few things, but we have a lot of cases to at least wrap up before we figure out what we're going to be doing next. Guys, so we're going to be starting our procedures very soon. Unfortunately, I'm not going to be able to show you all the procedures because of patient privacy, PPE. I stay away from my phone, but I'll try and keep you looped in as much as possible. Meanwhile, what you can do is leave some questions for me if you have, and in between patients, whenever I can, I'll try my best to answer them. Hi guys, so it's almost lunchtime finally, and what we've done till now is, out of what you saw in the morning, we did have a bunch of cancellations because of COVID. A lot of patients are preferring to stay in, or they're in quarantine. So what have we done until now? We've already fixed the PFM. We've done the FI for that. We've done another preparation of an articulated tooth. And we've done something up till now, and now it's lunchtime. Post lunch, we have a bunch of our Invisalign appointments lined up, which is what we're going to be looking at. And post lunch, that's what my team is going to be prepping and sanitizing for. We also did this Invisalign delivery today. We've given our patient her first few aligners because actually quite a few, I would say, because we don't know, with the impending lockdown, what it would be like. So we're just trying to touch base with all our Invisalign patients right now to make sure that they're comfortable just in the event of any kind of lockdown that may happen. Okay guys, so that is the end of my day. I'm now going to sit on some really boring stuff that I would want to talk about. We finally wrapped up for today. Finished a couple of more cases. I always feel like the one part that a lot of dentists don't understand, or rather dental students, I would say, is that there's a lot more apart from dentistry that you have to look at, especially when you're a practice owner. That's accounts. So now I'm doing my least favorite job at the end of the day, but you always think that dentistry is all about only dentistry, but no, there's a lot of clinic admin work that's also to be done. So I'm going to be sitting on all the paperwork, accounts, and all of that very piled up amount of stacks of paperwork, which I was doing before. So that's exactly what I'm going to be doing now before I can finally say goodbye to my work day. That's it from me for today, guys. I hope you enjoyed spending a day with me. I'm going to be going home now, and I'm someone who really believes in a work-life balance. So I wouldn't say it's the end of my day, it's the end of my work day, and I always look forward to going home and spending time with my family, watching my favorite show, eating my favorite food. So hope you enjoyed this. I'm so glad you could be with me. Until then, goodbye. See you, and thank you, Dental Leaders of India, for doing this with me. But not the least, guys, please mask up, please social distance, and please stay safe. It's really bad out there. So please follow everything you can so that we can get out of this together sooner and safer.